I'm going to be going over the P4 interview that we did and what he said, and also the other questions in the assignment. So, what does it mean to practice as a pharmacist in this setting? It's an outpatient pharmacy focusing a lot on mental health and anti-psych medications. And to be a pharmacist here as well, it's also being able to look out for patients because they may not be adherent or remember when they're picking up a refill, especially because some of these medications are like a once monthly injection. So if you're only taking it once a month, it's kind of hard to remember, oh, it's time for me to get it again. So to also be a pharmacist here is also to work really closely with patients to make sure they are on their drugs, to make sure they're adherent to them, especially if they're on multiple drugs. So, what does a typical day look like? In general, it's kind of slow, especially if you're used to the fast paced retail setting. But a typical day kind of has that community flow, that retail workflow where you help with picking up, where you help with filling, verifying, calls, transfers, all that. But what makes it different, it's also part of a clinic. So there are nurses and providers around, and you also work with them in throughout the day. What are the pharmacist's duties? It's receiving scripts, filling those scripts, verifying them. Something that's also interesting is that since you're in a clinic, you can also look at labs. So the pharmacist in P4 were telling me that they sometimes look at the labs of a patient to see if they should continue on this drug or if they should switch it, factors like that. And there's also some here and there counseling where they're counseling patients on their drugs, when to take them, how to take them. Does it take any additional training to work as a pharmacist there? The P4 said they don't think there's any extra training necessary to work in this setting. What does the P4 student do on rotation? So, as I've mentioned earlier, it's just like similar to what a typical day looks like. You know, the community workflow, calls and transfers, filling, helping the nurses, talking to providers. The workday, the hours, it's usually from 8:30 to 5. Sometimes they come in later or they leave earlier depending on the amount of work that gets done and how quickly um, their work gets finished. What projects does he or she work on? So he works on inventory projects, counting expired medications, and he said there might be a poster presentation at the end of the rotation as well. Would he or she want to work here after graduation? Why or why not? So he was saying that if you're into retail, this is a really good um, option for you as well because it works similarly to a retail setting. And the P4 said he's not opposed to working there since he does like that community workflow. What advice can the P4 student give you to succeed on rotations in general? Treat them like little job interviews. Make sure that you are showing up, that you are trying, and you are putting your best foot forward. He also said to keep your options open because of how big this world of pharmacy is. You should be open minded and just take everything as a learning experience because you'll never know what you can learn and what you might like. You never know. He also said to network and just be nice to people in general. So, would I complete an Appy rotation here? Um, I honestly would. I think I would be interested in completing an Appy rotation here. It's a setting that I'm kind of familiar with the workflow, like the retail workflow. And what's also nice is that it's kind of specialized and getting into the nitty gritty of those medications and being that medication expert, working with the nurses and other providers that are part of that clinic, I think it would be an amazing learning experience, not only getting to practice as a pharmacist, talking about the medications with patients, but also working with other providers and having that level of interprofessionalism for this rotation is something that's also really interesting, and in general would just be a great learning experience. Would I be interested in this area of pharmacy as a career? I would be interested in this area of pharmacy as a career. Like I've said before, you really get to act as the medication expert and not just work with patients, but also work with providers. So, in a way, you're kind of like this bridge between the medications and everybody else, and the providers and the patients, which is just what a pharmacist is in general. But for that site that I went to and that experience, I would be really interested as doing that for my career.